Tell me about some good medicines that are there for specific anxiety disorders. So I can let you jump into generalized anxiety. I can let you jump into phobias or panic disorders. What comes to your mind as good treatment out there? I just wish people knew about it.
Well, I mean, for instance, let's take generalized anxiety disorders. You usually refer them to get some good psychotherapy. And for some, it's a traditional psychotherapy that's just by a superior therapist. And others, it's cognitive behavioral therapy. Buspirone, which is a very simple old medicine to take, and generic medicine, may help generalized anxiety disorders. Traditionally, there are a number of the antidepressants have been used for many of the anxiety disorders and OCD and PTSD. They tend to stop some of the broken record aspect of this, whether it's OCD or recurrence. I'm awake again today and I'm anxious and tense again today. And then sometimes you have to go to other agents, hydroxyzine, and we try not to just run to benzodiazepines, but
now,
sometimes
benzodiazepines, that would be your Valiums and Xanaxes in that group?
Clonazepam, there are a number of agents in that group, including Valium, but you don't want a person to spend their life on it.
And is it easy to get hooked on those? Do people to get dependent on anti-anxiety medicines like the benzodiazepines?
That group has a substantial habituation or addiction rate. And it needs to be monitored. And again, the earlier you can get to this, it's often something that's simpler and less. Xanax has a bit more rewarding for the moment, so that's often something we try to move to a longer term benzodiazepine and then hopefully off of them.
Do people ever get hooked on the SSRIs or the antidepressants or anything like that that you mentioned earlier?
They're not addictive, but there's withdrawal from, so there can be a habituation with specific ones of them. Sometimes paroxetine or Paxil, sometimes venlafaxine or Effexor.
Let's go through those names. You're used to those a lot, but paroxetine
is Paxil. Paroxetine is a generic Paxil. Effexor or venlafaxine, those are harder to get off. But how you get off of them, again, it's not addictive. It can be in a habit where your physiology expects it, but you just do it slowly if you want to get off of them.
Good. So there are medicines that help, but then you take over with psychotherapy as you withdraw with those?
You take over psychotherapy in parallel.
Okay.
Because you want to get ahead of it and try to prune the medicines.
So it's like everything else. If there's a disorder, you go to the disorder guy. So if you've got a mental disorder, you go to, how do you know if you need to go to a psychiatrist or a psychologist?
Well, the majority of the treatments for anxiety disorders is probably started and sometimes completed by primary care physicians. Sometimes it's treated by psychologists or clinical social workers. And if it's successful in moving along, hooray. But you need to be expeditious in getting after it, because longer there, harder to treat.
Ken Jobson, you make me feel better. You make me feel like I know there's so much out in society that needs mental illness treatment, and yet there's treatment and there's guidance and there's things that you can do.